Today we have a wonderful panel and a complicated topic that we're going to try to address systematically if we can. We have some of the county's foremost experts in violence prevention with us today. Arnold Perkins, Alameda County Public Health Director. Violence? Is this a public health problem?
Absolutely. Public health is about health. It's also about disease. It's about prevention. It's also about outbreaks. We've had an outbreak of violence within our community.
Like Arnold, I was born in West Oakland, so around the time he came, I remember West Oakland as a very vibrant community when Climax High School was nationally known and acclaimed.
Many of our young people who are unfortunately committing acts of violence are products of their environment. When you grow up in a destructive, devastated environment, you're often going to display destructive behavior. So when you grow up in many inner cities around the country, particularly West Oakland, is an environment of blight, poverty, high unemployment, low quality schools, substandard schools, and you have a liquor store on nearly every corner. You have illegal drugs readily available. You have guns easily accessible. When this is your environment, destructive behavior is going to be the outcome.
What has to be done is to get the families together and start paying attention to their offspring. So I really am an advocate for people to stay home, somebody stay home, take care of those kids when they get home from school. So otherwise, don't have kids. You get somebody that's working and taking care of their kids and trying to do it right, they're class act as far as I'm concerned. They're doing the right thing. A parent trait, any idiot can make a kid, but not anybody can be a father.
When you have a community that's really devastated, we need sincere investment in families. We need investment in schools. The education system in Oakland is horrendous. And there is a school-to-prison pipeline that's being built that the #1 indicator of future incarceration is poor academic performance.
These communities don't look the way they do out of nowhere. It's governmental policies. I often say 80% of the problem in community is government, not people. They do to community as opposed to with community. And we need to make a change.
With a lot of people involved in our community groups, they're starting to see that there's something that I have to contribute as a community member, as a citizen of Oakland, that is much more than me going to a meeting.
And that's the role that we play in public health, is to encourage people to take hold in their community, to reach out to your neighbor next door, because it's those folk who live in the West Oakland community that will change things, not law enforcement, not public health.
Well, West Oakland has a disproportionate number of abandoned buildings, liquor stores, rundown houses, junkyards next to rundown houses. You can just see from the master planning that has gone in West Oakland that there's been no real plan at all.
Many of these young people grow up in a culture of death. The music they hear on the radio perpetuates some of the most horrible behavior. The videos that they see, they're in class where teachers, they're in the back watching their PSPs and watching music videos instead of in school. And so these failing systems and the devastation of the community has led to the delinquent behavior.
I would beg each and every adult to become a mentor to a young person somewhere. Because what the studies show is when young people are connected to a positive adult person, they make a change in themselves. So you can make a direct change in somebody's life today by just being a mentor. That would be the #1 thing on my list.
We're going to talk a little bit about the broader topic of adolescent health and see from our community what's going on that's creative around getting youth and adolescents involved in their own health and taking ownership of that.
This is the Berkeley High School Health and Wellness Fair. It's hosted by a lot of different groups from all over the Bay Area. Anybody who has to do with health and wellness. My group, Passion, has 2 booths, one for sexual health and one for drunk driving. So it's a really big fair that we have at Berkeley High School every year.
And in the late 80s, early 90s, the science became much more sophisticated, and we really now understand asthma as a disease of inflammation. That is the main thing that's going on. Like so many diseases, it starts with inflammation. And this inflammation not only clogs up the breathing tubes, but actually makes these muscles on the outside of the breathing tubes very sensitive. So just a small trigger might cause these muscles to squeeze down. So really asthma is two things. It's inflammation on the inside of the breathing tubes, and it's the muscles that then squeeze down and make it hard to breathe.
Asthma as a disease is on the rise. We know, for example, that self-reported prevalence of asthma, sort of how common the disease is, has increased by about 76% just over the past 20 years or so.
There's two main kinds of medication, one that treats the immediate symptoms and one that prevents the asthma attacks and helps to get it under control. So I go over the different warning signs for the families to look for, the symptoms that a child might have, so they'll know when to give the various medications.
We used to manage the symptoms of asthma, and now we know how to prevent asthma. The problem with the new way of doing things is that in order to prevent asthma, we really need our families who have children or they have asthma themselves for adults to take medicines every day, even when they feel well.
I have asthma, and 2 of our 3 guests also have asthma. And one of the things we know is that in certain communities, particularly low-income communities with lots of African Americans in particular, and Latinos, the rates of asthma can be astoundingly high.
There's a lot of work happening at the state level, but also here in the Bay Area, to decrease, for example, emissions from diesel buses or from trucks that visit the port. Margaret will have a lot to say about that.
We are inundated within West Oakland by diesel. And by having diesel, as I have learned over the years, that diesel can trigger asthma attack. And so being that close proximity to that kind of activity of the port, community is just accessible to that poor outdoor air quality.
Wow, the Port of Oakland is the 4th biggest port in the country, and 12 to 14,000 truck trips a day. That's astounding.
So people either have to be educated around the use of having better indoor air quality, or being able to buy those devices that support that to better have better indoor air quality, or we have to address all the housing stock in West Oakland has to be much better, so that you do have a better quality of air inside.
A project was proposed designed to increase preparedness among vulnerable groups like seniors, the poor, and people living with disabilities. We realized the Irvington neighborhood in Fremont had this kind of vulnerable population. This led to the creation of the Irvington Neighborhood Emergency Preparedness Project. We decided to launch the project with a preparedness survey.
Our community partners included the City of Fremont's Fire Department, the Fremont Family Resource Center, the Irvington Neighborhood Network, and many other community-based organizations.
In our diverse community, finding a sufficient number of bilingual speakers is sometimes a problem. Not so on the Irvington survey.
This is the Rough and Ready drill. It's taking place in the city of Fremont. And this is part of, in conjunction with a state exercise, which is called Rough and Ready.
So the scenario here is that we're responding to a anthrax attack that has occurred in the city of Fremont, and potentially the entire city of Fremont, which is a population of 210,000 people, have been exposed to anthrax.
A mass dispensing exercise is a role play of going through dispensing medicines emergently to a population in the event of a public health emergency or a public health threat.
I'm staying in a program called Project Pride. It's in Oakland. And I was in jail, and I got there from jail. And also I just had a baby, which was detox and methadone.
So tell us a little bit about what life was like when you were actively using.
Well, I was still pregnant at the time. I was doing a lot of drugs. I was out there prostituting at the time, just doing a lot of drugs. And it was just miserable. I just should have been, I just didn't feel like I was alive anymore. My hopes and dreams are for me to continue being a good mother to my daughter and to eventually get housing, which I'm working on now. So life's getting better every day.
Wonderful.